My name is Dr. Cassie. I'm a physical therapist at Body Balance Physical Therapy. For those of you who joined me at my workshop on Monday, I'm kind of doing a little bit of a follow-up today just to go through a couple exercises that are really good for patients or people with knee osteoarthritis. So if you have knee OA, please keep watching and try these exercises out. I'm going to go through two specifically. Something that happens a lot with knee osteoarthritis is the ability for your leg to go all the way straight. A lot of times your knee can be kind of stuck here and it doesn't want to go all the way straight. So restoring that extension is very important. If you think about when we walk, like when we stand up and we take one step and step through, we want to make sure that the leg that we're standing on goes all the way straight. And if your knee is kind of arthritic and stuck and it can't do that, then that can cause other problems, having sciatica in your hip or adding extra pressure to any other joints. So in order to help with that extension, the muscle that does that action is your quad. So this muscle along the front of your thigh, your quadriceps. So while you're sitting at the edge of your chair, and I would recommend to do this with your good leg first, or maybe your non-symptomatic leg, or a leg that's a little bit better, just to practice so that you know what it feels like when you do it on your other side. So scooting all the way to your edge of your chair with your leg all the way out straight, you're going to try to squeeze your thigh muscle, so like flex your thigh muscle. What you should see is your kneecap lifting up a little bit and then your leg going straight back. This should cause maybe a little bit of a stretch along the back of your knee. Hold that for about 5 seconds and then relax. Now, I am not a no pain, no gain person. I don't have that mentality. I don't think you should be a masochist. Don't hurt yourself. So if you have a little bit of pain, don't go as far, don't hold as long, or maybe don't do as many. A little bit of discomfort is okay, but if it lingers for any more than a minute after you do it, then it might be a little bit too much for you. So you're the judge of your own body. Just make sure that it's not hurting afterwards. So I would do this as many times as you can throughout the day, at least 5 to 10 repetitions at a time, holding for about 5 seconds. The other thing you can do is add a little extra of an oomph, or like a little bit of a mobilization to yourself. So with your leg relaxed out in front of you, what I'm doing is I'm leaning forward and putting my hand on my thigh, and I'm pushing straight back this way to feel a little bit of a stretch along the back of my leg. So we're trying to help restore extension. Again, holding for a couple seconds and then relaxing, just a gentle stretch. If it's too intense, you could also make sure that you don't bring your toes up. You can relax your toes a little bit to take some nerves on slack, or just to make sure that we're not tensioning our nerves. But something that is a hallmark with those that have arthritis in their knee is that the ability for their knee to straighten all the way is not there, or it's kind of stuck. So trying to restore that extension is really important. So as I talked about on Monday, there's a lot of other treatment options that we can go through, not physical therapy related. You can get injections, you can get orthotics, or even weight loss will help a little bit with your pain relief. But then in terms of physical therapy, what our goal is to make sure that the arthritis doesn't progress any further. And we're working on that through improving the mobility in your joint. So what we kind of just worked on is restoring extension. Working on flexion is good too, but I'll save that for another video. So motion is lotion. And then strength is a huge thing. So there's really good evidence to support that if your quads are strong, then that helps, again, that prevents the progression of knee osteoarthritis. And then even just on the other, just from another point to make about the quad strength, is that if you are planning on getting a knee replacement, there's really good evidence to show that those who have strong quads before surgery have really good outcomes after surgery. So working on the strength of your legs is really important, regardless of whether or not you're going to have a knee replacement. So to work on strength, there's a lot of different things that we can do. but I'm going to teach you right now just a classic sit to stand. So scooting to the edge of your chair, make sure that your feet are directly underneath your hips. And what we're trying to do is push through our feet and levitate. Try not to throw yourself forward and hinge forward. So don't use your momentum to help you. Try to use your muscles. If you are unable to get up from the height of the chair that you're at, you can always increase the height to give yourself a little bit of a boost. So as I stand up, I will hinge forward just a little bit, but again, I'm not throwing myself forward, and then I'm coming straight up, and then I'm going to go slowly back down, and then do it again. What we should be thinking about is not using momentum, but then the other thing is what our feet are doing. So you might find yourself falling back onto your heels. That's not a good thing just because we want to use our whole foot to help keep us stable and to keep us balanced. So think about having a tripod in your foot, so having equal weight between the ball of your big toe, ball of your pinky toe, and your heel. So having that kind of suction, or that balance through the whole foot as you stand up, and then slowly control back down through that tripod of the foot. You can do as many of these as 5 up to maybe 15 to 20, whatever your body can handle. But what I care most about is that everything is controlled and that all the muscles are working together well. So hopefully those 2 exercises are going to go well. If they don't, please come in for an evaluation so that we can maybe tweak some things and make sure that you're strengthening appropriately and treating your body appropriately so that you're strong and resilient and durable and you can keep doing what you love to do. Thank you guys for tuning in, and I will see you next time.